Hello everyone and welcome back to my playlist of Pharmacology from Lippencott. We are doing drugs associated with anemia treatment and we have already talked about specific drugs जिससे हम anemia को treat करते हैं, and then we also talked about those drugs जो neutropenia के लिए use होती हैं. And now we will finish off the chapter by discussing the drugs which are used to treat sickle cell disease, right? So let's begin our discussion. Now the drug in this domain to remember is hydroxyurea. Now first of all you should actually know the pathology of sickle cell disease, which I'm not going to go into the details in this particular video because ये pathology में हम detail में discuss करते हैं. But there is a change of single amino acid and the shape of the red blood cell changes from biconcave to sickle shaped, and sickled shaped red blood cells, since they are no more normal in their shape, their physiology changes, okay, and that's why the sickle cell disease happens. Now this particular drug hydroxyurea, that is given orally, and it's a ribonucleotide reductase inhibitor, and that can reduce the frequency of the painful sickle cell crisis. Now you should know that the patients with sickle cell disease may actually demonstrate a normal lifetime, but at times, such as if they have infection or if there are situations of hypoxia or any stress, so there are conditions जिसमें sickle cell crisis develop होते हैं, and then there are painful crises in different parts of the body. So उसको stop करने के लिए, उसकी frequency को रोकने के लिए hydroxyurea is a very nice drug, okay? In sickle cell disease, hydroxyurea increases fetal hemoglobin levels, and that's how it works because जो abnormal hemoglobin बनता है in patients में, which is what we call the sickle hemoglobin S. अब hemoglobin S की oxygen carrying capacity obviously different है. So how this hydroxyurea works is by increasing the level of the fetal hemoglobin. So in theory जो problematic hemoglobin है उसकी concentration को actually dilute कर दिया जाता है because this drug promotes the formation of hemoglobin F. So ये एक simple तरीक़ेकार है जिससे आप ये चीज़ याद रख सकते हैं. Polymerization of hemoglobin S is delayed and reduced in treated patients. So obviously that is the problem, और इसको dilute कर दिया जाता है, इसकी polymerization delay हो जाती है अगर hemoglobin F की concentration को बढ़ा दें. So these patients live a happy life. The painful crises are less and they are not caused, and there is no sickling, तो capillaries block नहीं होती, tissue anoxia नहीं होता, pain नहीं होता. So the clinical scenario improves very much. Okay. A clinical response may take 3 to 6 months, however, after taking hydroxyurea. Important side effects of hydroxyurea include bone marrow suppression and cutaneous vasculitis. These are very two important. Boards में ये बहुत ज़्यादा पूछते हैं, चाहे वो step 1 हो या आपके undergrad examinations हो, the side effects of drugs and hydroxyurea as well. It is important that hydroxyurea is administered under supervision of a provider experienced in the treatment of sickle cell disease, because these patients sometimes have immediate vasculitis reaction, and bone marrow suppression obviously is a serious phenomenon, because when we talk about bone marrow suppression, there will be anemia, there will be neutropenia, there will be platelet deficiency. All these are problematic stuff. Now hydroxyurea is also used off-label to treat acute myelogenous leukemia, psoriasis and polycythemia vera, different usages. Now actually जो sickle cell का पूरा topic है, we will medicine में हम इसको बहुत detail में पढ़ते हैं कि why and how the hydroxyurea is actually working. Anemia में ये इसलिए पढ़ाया जाता है because it is anyways related to hemoglobin S, and then hydroxyurea increasing the concentration of hemoglobin F. So you should have an idea of what we are talking about, okay? Right, so now if you look at this diagram, this is then summarizing everything what we have done so far in this chapter. So if you talk about treatment of anemia, there are drugs which actually help formation of more red blood cells by providing vitamin B12 or by providing iron supplements or folic acid. So these are the things which are intrinsically used by the red blood cell to produce hemoglobin. Then we can give some factors which are actually factors which are made in the industry, but they mimic the function of natural chemicals. So for example, erythropoietin in your body is responsible, it is produced in the kidney, and it is responsible for formation formation of red blood cells in the bone marrow. So that is a hematopoietic factor. और इससे similar हम drugs भी use कर सकते हैं. So we have done all these already. Then we also talked about drugs which were used for neutropenic patients, and those drugs were largely granulocyte colony stimulating factor or granulocyte macrophage colony stimulating factor. And now we have just talked about what is the single drug that is very much clinically relevant in preventing the symptoms of sickle cell anemia, and that is hydroxyurea. So you should know the side effects, you should know where else it is used. One important thing as well, remember, by using this drug hydroxyurea, actually we are not per se treating the disease. यानी ऐसा नहीं है कि हीमोग्लोबिन सिकल या हीमोग्लोबिन ऐसा बनेगा नहीं, या जो ग्लूटामिक एसिड वेलाइन का शिफ्ट है अमीनो एसिड का वो करेक्ट हो जाएगा. इट्स नॉट लाइक दैट. सो द करेक्शन ऑफ द डिजीज एक्चुअली डज नॉट हैपन. देखें व्हाट इज हैपनिंग कि इन पेशेंट्स में फ्रीक्वेंसी ऑफ द पेनफुल क्राइसिस आर रिड्यूस. सो इट इज़ वन ऑफ द ड्रग्स विच इम्प्रूव्स द पेशेंट्स क्लिनिकली, नॉट नेसेसरीली कि पूरी डिजीज़ ठीक हो जाती है. और मेडिसिन में बहुत सारी डिजीज़ में ऐसा है, और सिकल सेल डिजीज़ तो बहरहाल एक जेनेटिक डिजीज़ है. जेनेटिक डिजीज़ में सिंपल ड्रग्स देकर आज की तारीख तक तो ऐसा हुआ नहीं है कि म्यूटेशंस को ऑल्टर कर दिया जाए ना. इट्स अ वेरी लॉन्ग. हो सकता है फ्यूचर में ऐसा हो कि आप कोई ड्रग लें एंड द म्यूटेशन इज़ करेक्टेड और द अमाइनो एसिड चेंज इज़ करेक्टेड फॉर, लेकिन इस वक्त ऐसा नहीं है. सो व्हाट वी आर डूइंग एट द मोमेंट इज यूजिंग द ड्रग एंड ट्राइंग टू डाइल्यूट द हीमोग्लोबिन एस ताकि पेनफुल क्राइसिस ना हो. सो इट इज इंप्रूविंग द पेशेंट क्लिनिकली, इट्स नॉट रिवर्टिंग द डिजीज. एक्चुअली बहुत सारी डिजीज में ऐसा है. थिंक अबाउट हाइपरटेंशन. हाइपरटेंशन में आप एंटी हाइपरटेंसिव ड्रग्स देते हैं पेशेंट को, तो हाइपरटेंशन खत्म नहीं होती, इट रिमेन्स कंट्रोल्ड. डायबिटीज़ मेलाइटिस के बारे में सोचिए. इट्स अ वेरी कॉमन डिजीज़ एंड इसमें भी आप डायबिटीज़ ख़त्म नहीं करते हैं, यू जस्ट मॉनिटर एंड कंट्रोल द ग्लूकोज लेवल. सो यू ट्राई टू कंट्रोल द डिजीज़, you try to control the patients clinically, and hydroxyurea is one of the same examples. Okay, so that finishes the chapter. I would recommend कि इस तरह questions आप solve कीजिएगा ताकि आपको एक idea हो. So for example, which is an appropriate treatment for nutritional anemia that presents as hunger for eyes? So that is the pica syndrome, definitely iron deficiency. So बगैर देखे मुझे पता है कि it is to be iron and the correct answer is iron. Okay, so go through these questions at your own. कोई difficulty होती है जो मुझे मैसेज में आप बताएं कि क्या मसला है. ठीक है जनाब. तो this chapter number 42 from Lippencott is done and dusted. Take care of yourself.